Joining us in the studio for more is Dr. Stephen Lee, Vice President of Program Implementation and Country Management with the Elizabeth Glaser Pediatric AIDS Foundation. Dr. Lee, welcome to Africa 54.
Thank you for having me.
Great. Also joining us is VOA's Anita Powell, who is standing by live via Skype in Durban, South Africa. Good evening, Anita.
Hi, Lenore.
Let me start with you, Anita. What is the latest on the conference? Anything significant on maternal and child health?
Right. Well, we've had some really encouraging news from South Africa in particular. As you know, South Africa is the nation with the world's highest burden of HIV. And they announced this week that they have brought mother-to-child transmission down to 4%. You know, some scientists are saying, well, that's still 4% too many. But that is very, very encouraging. And it's like Carol said in her report, it's about implementing. We know that the science works. Having mothers take ARVs while they're pregnant does help prevent transmission. So it's just more implementation, better care, and it's looking very encouraging.
And Dr. Lee, what is your take on this? There is improvement on MCTC, and you are focusing on pediatric AIDS. What can you tell us?
Yeah, so there have been significant improvements in HIV transmission from mother to child. Great strides have been made in preventing pediatric HIV and reducing transmission from mother to child. An example of that does from the Elizabeth Glaser Pediatric AIDS Foundation. Just yesterday, we announced that we've reached 25 million women with services since we've started as an organization in 1988. And it's our services, providing services to women to prevent transmission of HIV to their babies.
So, Anita, what are experts saying in terms of scaling up access for these women that are not able to receive the care?
Right. So one of the strategies is to try to bridge the gap and try to reach these women in the social situations, as Carol said in her story, reaching them at church, reaching them in social situations, encouraging them to see HIV as just another part of your general health portfolio. You know, you get checked for HIV, for diabetes, for HIV at the same time. So that's kind of part and parcel of what they're recommending.
Now, Dr. Lee, there is a report that came out. Although there are good news, the report says about 70 countries around the world are seeing an increase in HIV infection rates. Now, what role does mother-to-child transmission play in this, especially looking at pediatric AIDS?
Yeah, so the major way that children become infected with HIV is through mother-to-child transmission. We have seen significant improvements, right? 58%, there's a 58% decline in new infections in children worldwide since over the past few years. But there's still that much needs to be done in terms of a decrease in that transmission. Now, we've just outlined some important aspects of reaching women. It's making sure that women have access to testing, they have access to treatment if they test positive, and then we're implementing strategies and approaches to ensure that they're retained in services once they get started on treatment. And that we're monitoring their progress and making sure that their medical outcomes and clinical outcomes are reflecting the treatment that they're receiving.
And Anita, did you hear anything about funding?
Right. This is one of the big discussions that swirls around every AIDS conference. Funding is always a major issue. As we've heard from the UN, the 90-90-90 target, which is 90% of people on treatment, 90% of people knowing their status, so on and so forth, is hamstrung by the need for more than $20 billion, I believe, around the world in funding. And that's just nobody sees where that's coming from. So, while this news may look encouraging, while we may see a lower rate in mother-to-child transmission, we've got to keep up the money. And that's the big question right now.
Your reaction, Dr. Lee, on the money?
I totally agree. I mean, it's really important for us to maintain the resources that are necessary to achieve those 90-90 goals. It's both the financial resources, but also the human resources. We also need to make sure that healthcare workers have the knowledge, the skill set, the capacity to be able to deliver quality services. So I think resources is both a financial resources, but then also a human resources to ensure that we provide quality services to women and their families.
When you look at the way ahead, looking at the target by 2030, what do you see as priorities, especially looking at pediatric AIDS?
Yeah, I think some of the major barriers that currently exist are things around practices, laws, and policies that discriminate or stigmatize people who are living with HIV or people who are vulnerable to HIV. So addressing those challenges are really important. Specifically for women and children is addressing gender inequality and making sure that young women and young girls are empowered to be able to address the issues that affect them most importantly in the social context.
Okay, we have to leave it there, Dr. Lee. Thank you so much. Anita, thank you for joining us.
Thank you.
All right, and that was VOA's Anita Powell reporting live via Skype from Durban, and Dr. Stephen Lee, Vice President of Program Implementation and Country Management with EGPAF.